How do you overcome that fear of being that new nurse on that first week on the job? You can't sleep the night before because you don't know what to expect. And when you get there, you can't stop thinking, I am not prepared. But no worries. Today, I'm going to give you tips that are backed by professionals and my years of experience to help you overcome that fear in no time. The reason why you feel so much anxiety is because you don't have a plan to get from not knowing to being prepared. You might know the little details as to where to meet, who are you going to be meeting, and maybe an outline of what you're going to be doing for that first week. But we still haven't closed that gap between not feeling confident to stepping over that learning curve of being a newbie. Yes, fear is normal and it's meant for you to react, but not just to go into your car and start freaking out because you don't know what you're doing, you don't know what you got yourself into. Luckily for you, I've combined 5 specific tips that are backed by MDs, therapists, and experts in combination with my 15 years of nursing practice to help you overcome the fear of being a new nurse. Let's dive into tip number 1. Understand your fear. We need to acknowledge what's your fear because we can't fix anything that we just don't know what we're fixing. To do so, there are 4 strategies you could use to help you understand fear. Cognitive behavioral therapy, or CBT. So you basically want to name the fear, reject the fear, reprogram your fear, and rebuild by actions. The next strategy, it's called the exposure therapy. And this one is talked about Emma McAdam, where she introduces 6 steps that you could follow. Starting with identify the fear, set goals to overcome the fear, use those goals to set up action plans. Once you set the actions, you want to start by completing the least scary and continue repeating until you complete the worst fear. Finally, you want to celebrate that you've been able to overcome that fear that's stopping you from becoming the nurse that you want to be. The third strategy is called What If by Dr. Juval. And basically what it says is that you want to define the fear, you want to think of the worst case scenario, and you want to prevent from happening. So basically, if your worst fear is maybe getting into the unit and making a mistake or not feeling prepared, then you want to come up with a process so that you can create action steps and reprogram that mentality. 4th strategy, which is called the fear setting by Tim Ferriss. And basically what you want to do is you want to weight on a scale the benefit of doing the thing that you fear versus the cost of not doing it. And you could put that into perspective in like 6 months, a year, or 5 years. What would it cost you from not overcoming that fear in 6 months, a year, or 5 years? Tip number 2. Understand what orientation is all about and what you need to tackle to succeed. Orientation is the time for you to learn and understand that the only expectation your employer has at this point is that you know the basics, which usually include knowing what your normal vital signs are, your head-to-toe assessment, how to be a responsible employee. That's it. Everything else you're going to learn at the job. But if you want to become a competent nurse quickly, then we're going to do some extra work to get you there. And we're going to talk about it in a little bit. But for now, you need to follow these 4 steps to understand and tackle orientation. Step number 1, you want to make the decision if you're going to continue to stay with the fear or you want to move through the fear. The longer you sit in fear, the longer it's going to take you to become the competent nurse that you want to be. Now that you've decided to move through your fear, let's go into step number 2, which is setting up realistic expectations. Now, if you don't know what the expectations are, I want you to go ahead and ask your manager, or you could ask the nurse educator. By doing so, You're gonna be able to listen from them what the expectations are from you, and it's gonna make you feel better because you're gonna be able to set realistic expectations to help you go through the orientation process. So now expectations are set. Now we're gonna work on setting SMART goals: specific, measurable, attainable, relevant, and time-bound goals. So basically what you want to do is set a few goals throughout your orientation process so that you can move towards becoming that competent nurse that you want to be. For example, by week 1 or 2, I'm going to give report on 1 patient. Or by week 3, I'm going to be taking care of 2 patients on my own. This will help you create a plan, which is the key to overcoming fear during that first week. We will talk about this in more detail at the end of the video, so you definitely don't want to miss it. Before we get to the plan section, there are 2 more tips that we need to talk about that are very important. And that is tip number 3, create your resource list. You are not expected to know all the answers. You're not. However, it is very important that you know where to find the answers. This is why you need to create a resource list so that you can have something to reference from whenever you don't have that undivided attention from your preceptor. I want you to talk to different staff. Ask them if they have time to talk to you. This will help you build connection and trust. Ask them what kind of resources they use to get the job done. Create a document where you can put all this information down, or you can bring a notepad so that you can continue building as time goes by. So in the future, you can become that nurse that everyone goes to for an answer. And like Dr. Mike suggests, you need to add to that resource list a family member that you can call whenever you need that emotional support, because at some point you're gonna need that. So far, we focus on the job logistics, but what about you as a person? How do you help yourself overcome fear? This is where we get into tip number 4. Prioritize yourself. Eat healthy, stay hydrated, and at least for the first week, try to avoid sugars and caffeine. You want to lessen the constant blood sugar spikes or the side effects from caffeine because it could exacerbate your anxiety, which will affect your concentration levels during orientation process. Practice deep breathing exercises, and you could try the 4-7-8, where you inhale for 4 seconds, hold it for 7, breathe out for 8, or you could do the 4x4 box, breathe in for 4 seconds, breathe out for 4. Basically, what you want to do is take that break so you can allow your brain to calm down from all the information overload that you're getting on that first week on the job. Take a 5-minute break so that you can allow your mind to relax a little. Take a deep, refreshing breath, and then reinforce to yourself that you're doing exactly what you need to do, and you're doing great. At the end of the day, I want you to journal down what was your weakest point, what you learned, and what you did right. Debriefing at the end of the day will help you physically see where you at in the orientation process. By practicing this habit, it will help you build on the next tip that is the most important of overcoming that fear as a newbie. And that brings us to tip number 5, create a plan. So you now understood what your fear is. You've created realistic expectations. You understand what the orientation process is all about. You've created that resource list that's going to help you in the future. And you prioritize yourself during that process. But now we build a plan to tackle orientation and help you decrease that fear of being a new nurse. To do so, you want to create an action plan in a form of a checklist. Most employers will give you a competence or a performance checklist that you can go by while you're going through orientation. If your manager or your nurse educator has not provided you with one, you could certainly ask for a copy of the nurse's competency This will give you insight as to what you need to know and what you need to work on by the end of orientation. You can also go ahead and check out the description area for the link to my precepted checklist, where I created a document to help you guide your orientation process so you can get the most out of it. And again, schedule some time either on your days off or at the end of the day so that you could go over on what you feel are your weaknesses and you can improve upon them. I want you to plan for the worst case scenario, because if you plan for the worst, then you'll be ready to tackle anything that comes your way. Finally, don't forget to prioritize yourself. It's okay to not know it all. Be nice to yourself and know that in no time, you're gonna become that competent nurse as long as you follow the tips that I just provided you. I hope you enjoyed this video. And if you wanna find more helpful videos like this, make sure that you subscribe so you don't miss any of my videos. In the meantime, check out my other videos.